It is our pleasure to be hosting Cap Wilkes and Emmy Ferguson of Wellbeing Development. Cap is the Executive Director of Wellbeing Development and a rural health consultant with a lot of extensive experience in the industry, working in 40 different states, I believe it was. Oh my gosh. And Emmy is the Program Manager of Wellbeing Development. So let's welcome them to the podium.
Thank you, Lacey. It is really nice to be here with you today. So we're going to present Emmy. I'll be sharing the microphone with Emmy here. I'll get about halfway through the presentation, and then Emmy will introduce herself and take over from there for the rest of the conversation. As Lacey mentioned, Executive Director is my role with Wellbeing Development. I'm here today to introduce myself, Emmy, our team, and the project that we were working on. Other folks on the team include Beth Chapman, Deanna Swenson, Lisa Liddell, Rihanna Hegman, and Robin Bertelson. So those are folks that are partners, staff, program people with Wellbeing Development and our project that's focusing on recovery. We wanted to say really a appreciation for you being here today and gathering and hearing about our project. We are really intentional about talking about our project at the early stages and gaining your input and feedback. So let's see, gotta do a couple things at once. I have several slides I'm working on. So in our agenda today, we're going to tell a little bit about wellbeing development. I want to talk a little bit about why we've brought you into this conversation with us. We're also want to talk a little bit about what is substance use disorder, some data, some definitions, some of the data that talks about needs, and then also what we're thinking about for a recovery type of program. That will all take about 20 minutes or so, 25 maybe. Then we're going to have some quiet conversation. So breaking up into groups of 3, 2 or 3. I have some handouts at the beginning of the room. There's a green packet and then also a piece of white paper. We'll be looking for you to think about the presentation that we're providing and also write some notes that at the end, if you'd like to hand them in, we will incorporate those into our thinking and your input will influence our design and implementation steps. So that's at the end of the conversation today. And we'll wrap up before 1. Are we the only topic? Oh, great. So we'll wrap up by 1. And then Emmy and I will be hanging around. So if you wanted to have some more conversation, of course, you're always welcome. We love to talk about this. So wellbeing development, it's truly a community-based nonprofit agency. It was formed in 2010 by community members who got together and said, you know, we have friends and family that are really struggling with some chronic mental health issues, substance misuse, and what are we going to do about these behavioral health kinds of needs? And they got together and formed Wellbeing Development. Wellbeing development helps with the challenges that come in between the more formal services like therapy or counseling or some of the physical services that are available in our town. Our mission is to provide behavioral health resources and education in the Ely community. We want all people in our community to be able to live their very best lives. And when we talk about behavioral health, we're talking about a pretty broad array of issues outside of physical health. So things like chronic depression and anxiety and illnesses like substance use disorder. You know us pretty well, probably through one of our programs, the Northern Lights Clubhouse. We also host a care facilitator and participate in Ely's Pathways to Wellness. Pathways to Wellness is a program that consists of a group of healthcare agencies that are all working together to make it easier for community members to find help to meet their wellness and health goals. Sorry for these long pauses, it's gotta catch up. I would like to give you a little bit of background about how we got to this point today, where we're providing a presentation on a recovery program. In early 2023, so earlier this year, we received funding through the St. Louis County Opioid Settlement Fund Committee. These are monies that the pharmaceutical companies were required to pay for remediation to harm from opioids that have really been a dirge in our across our whole nation. We have been using the opioid settlement funds to help us with some exploration. We've been doing research to better understand circumstances and possibilities around substance misuse, substance use disorder, recovery, and the kinds of aspects of helping people that are struggling with substance use. And we've been talking with folks in the community. So we had some time we spent at the Harvest Festival gathering surveys. We've had key informant interviews. And the goal and conversations like this is kind of our next step. And our goal is to gather input and perceptions and insights around recovery in our community, both needs and opportunities and ideas, so that we can do a better job of creating a recovery program that fits our community. We use this kind of work to lean more into our vision of helping people live their very best lives. We are going to be talking about some definitions and data, but I wanted to talk a little bit, just take a moment to say why we are in this room with you guys today. This is an informational session. And as community members, we know that you care about our community. You're invested in our success as a place to call home for our families, our neighbors, our friends. The most practical reason for being here is to gather that input and insight perspectives that I talked about. But another one is to really celebrate and recognize the strengths in our community about caring about each other and making a difference together. So with your input and this conversation we're going to have today, you will be helping us together make a difference here in the Ely community. For the next few minutes, I'm going to share some findings and research on harm and the loss that misuse of substances can have in our communities for the people that we love and possibly ourselves. To get started with this kind of heavy part of the presentation, I want to share with you some of the underlying assumptions and worldviews of our project team. We share with you this to emphasize the gravity of this conversation and the serious nature of the topic of a community-based recovery program. Within our community-based recovery program, we recognize that substance use disorders is an illness, a chronic disease. It's not a failing of someone's character to be addicted to drugs and alcohol. Our recovery outcomes are improved by treatment. This is one of the words that you'll hear us use. Treatments are things like medication to help reduce the need for the drug or the alcohol, peer support groups, and housing support. So these are like, people might refer to them as interventions or treatments, and they're that programming that is what describes a recovery program. We also want to acknowledge that a person-centered approach means that there's no one right way, but rather that the uniqueness of each individual and their readiness for seeking recovery drives the approach and the path of that recovery. We really don't know when someone is ready to move into abstinence or sobriety, but when they are ready, we want a recovery program that's available to them and easy to access. That's what we mean when we talk about a person-centered approach. We also know that it's really important to support the family and the loved ones of the person that's struggling with the substance use or the addiction, because the ripple effects are wide and far. Not only family and folks that love them, but also our community is affected by substance use disorder. Thank you. Just getting sloppy with my elbow. Yeah. So the definition of substance use disorder, this comes straight out of the Substance Abuse and Mental Health Services Administration. It's a federal department. People refer to it as SAMHSA, and also the American Psychiatric Association. So our experts who study the use of substances and the misuse of substances have come up with a list of the things that they look for when they diagnose substance use disorder as a disease. Uncontrolled use of a substance despite harmful consequences. Well, we certainly have seen this in folks that go back over and over again through a cycle of seeking sobriety, becoming active users again, seeking sobriety, becoming active users again, even when it hurts themselves and the people around them. I'm betting that many of you have heard the phrase opioid crisis. Just a quick show of hands. Who has heard of something called the opioid crisis in our country? Thank you for sharing that. Nationally, 16.4% of people living in our country have met their criteria for substance use disorder. That's 55 million people in our country have been diagnosed with substance use disorder. We know that many of this is from using pain medications. The opioid crisis came out of prescription pain medications, and it really touches across all parts of our country. And I don't have the number at the top of my head, but I know that there's data that supports that the rural communities have been affected even more than our urban neighbors. So it's real, and it is in every county across every state in our nation. The Minnesota Department of Health identifies alcohol and drug use as one of the leading causes of preventable illnesses and premature death. Preventable illnesses are things like accidents, heart disease, the way that we take care of ourselves, the things that maybe it was caused by an addiction, or maybe it was bad genetics. It's all gets intertwined. In St. Louis County, we've seen a rise of over 100% drug overdose deaths between 2018 and 2021. In St. Louis County, from 27 to 69 deaths in 2021. And now we know that there's also overdoses that haven't led to death, but we've lost a lot of people to this scourge. Data from Minnesota Regional Health Care Organization. So in Minnesota, through an electronic health record, so patients that come to a regional healthcare organization in 2021 from September to September 2022, 1 in 8 of adult patients living in rural Minnesota met the criteria for substance use disorder. 13% of the people in rural Minnesota already have a diagnosis of substance use disorder. One person that we talked to during the Harvest Moon Festival this past September shared with us the perspective that there's not a person in Ely who hasn't been affected by substance use. And then with your show of hands, I know there's lots of folks in this room that have had direct and definitely indirect experience with folks that are addicted to drugs and alcohol. There's many good people that shared this perspective with us while we were talking with them during Harvest Moon. To gather insights directly from folks that live here in Ely, we hung out at the Harvest Moon Festival. We did give ice cream treats, was quite a good incentive, but they really were willing to sit and fill out a survey. We had more than 300 surveys filled out. Of those, slightly over 150 were Ely community members. We also interviewed 8 community stakeholders, and some of you that were interviewed might be here today. Thank you. These were folks that were asked to share about 20 minutes or so to talk with us about their experiences and insights related to drug and alcohol use and misuse happening in our community. People were surveyed and interviewed, shared that they think that substance misuse is negatively impacting our community. And some of those forms were domestic violence, children are being impacted, that could look like neglect or abuse. We are spending resources in our for emergency support on folks that are misusing substances. Ely residents also noted a concern that there seems to be a lack of accessibility to services and transportation. And highlighted a need for this idea of more variety of support options. And as I mentioned before, it's unique how people respond to seeking recovery and staying on the path of recovery. And this was reiterated within our community as something that would be valuable to have here too, a variety of approaches to recovery. I'm going to pass the talking stick now to Emmy, and she introduce herself and continue with our conversation.
Good with that. Thank you. Okay, well, thank you everybody for being here and for having me. Once again, my name is Emmy. I originally grew up down by the cities, but I've lived in Ely for 8 years now. I came originally to work at Outward Bound and have been here since then, made the transition to going to school for social work. So I'm here now, invested in making Ely an even better community than it already is, which is a pretty amazing one, which is why I'm sticking around. So I'm going to sort of answer some of the questions that Cap brought up. And you might be thinking at this point, okay, it's clear that substance use disorders have a real and substantial impact on our country as a whole and on Ely, on individuals, families, and the community. And there's some clear gaps in services. So at this point, I would wonder, what are we going to do about it? And as you're thinking that question, so are the people who initially gave us this grant funding. So the St. Louis County Opioid Task Force, they asked a very similar question in the fall of 2022. So these are the people who were deciding what to do with this grant money from the pharmaceutical companies. And so what they did was they sent out a survey to key stakeholders in St. Louis County. So that includes people who work in the realm of substance use disorders, prevention and recovery, behavioral health specialists, care providers, law enforcement, tribal, county, and regional government, all sorts of people who are very directly involved in this realm. And they asked them, if you had $1 million, where would you put it? So 2 things I want to highlight about this list. These are the top 10 answers that people gave. One is that you'll notice right at the top is housing support. So for people who are intimately involved in this, they recognize, as do we as a community as a whole already, even without thinking about substance use disorders, the importance of housing and having a safe place to be, especially when you're going through a very tough time. So housing support came out right on top. And then the other thing about this list I'll go through is the diversity of options here. So you'll see housing support and then overdose prevention and syringe exchanges. Both of those are part of what we call harm reduction measures. So sometimes you'll hear in this realm an abstinence model. So you might think of AA or NA. And these are other options that say, we recognize that not everybody is going to be able to achieve abstinence right away. And there's an entire spectrum of help that we can provide to make sure that the worst doesn't happen, to keep giving people those chances to find their own recovery journey. So those are what's called harm reduction measures. Peer services, again, people need each other. Anybody who's been through a hard time knows that deeply personally. We heal in community, and peer services are known to be a really great predictor of positive recovery outcomes, having other people to support you in that time who understand what you're going through. So the next couple, there's some education, stigma reduction, harm reduction education. So again, pointing to, this is not just one piece of the puzzle. We can't just help that individual. It's also about how we as a community embrace that person. And if there's a ton of stigma and negative impact or ideas about somebody going through a recovery journey, that makes their journey a lot harder. So how can we think about doing things like this, being in a room full of people talking about this and helping people understand how to embrace people with compassion as they're on this journey? And then also there's post-incarceration programs, criminal justice-based treatment and recovery. So understanding those bridges between the incarceration system and getting people back on track after they've been struggling, as well as collaboration with existing efforts and community. So that's something that Wellbeing Development has already been doing, really promoting those ties between entities that already exist to make sure that people are wrapped up in services and have that communication between entities. And so this graphic kind of illustrates, as we were thinking about this list and what's most important, we really want to make sure that we're coming up with a holistic intervention. And we'll talk more about the recovery residence, but it is not just a place. A recovery residence and our program is really designed to be sort of like in this image, all of these different pieces of the puzzle coming together to support somebody. And you might, if you can see this image, I don't know if it's hard for the people in the back, but you might look at that guy and think, wow, it looks really hard to walk on puzzle pieces while carrying a giant thing. And that would be an understandable misconception. But what's really happening is that he has a lot more support in his corner to walk away with those pieces and carry that recovery capital forward, because in that house, he has access to all of these different pieces that help him put his life back together after he's struggled with the consequences of substance use disorders, which, as we've seen, can be really a difficult challenge. So to speak more about the recovery residence with co-located services, that's the official title of what we're going to be calling this place. It's the idea behind it is that it is a safe, sober, affordable place to live. So we're not talking about a super big facility. This would house about 2 to 4 people at a time. So it'd be a smaller, intimate group. And when we talk about abstinence, it's important to mention here, Cap noted medication treatment. Does anybody know any medications that are used to treat opioid use disorders or substance use disorders in general? You can go ahead and shout them out. Yep. Suboxone, also known as buprenorphine. These are evidence-based medications that are shown to help almost beyond any other intervention, improve people's ability to attain and sustain abstinence. So they are designed to specifically combat those addictions in the brain. As Kat mentioned before, substance use disorders are a disease, and they do change your brain chemistry and makeup. And it makes it incredibly hard to be making rational decisions when your brain is firing in a completely different way than yours or mine would be without the impact of those substances. So these medications are really, really effective at that. They would be monitored and are prescribed by doctors. So we consider use of these medications part of our abstinence-based model for recovery housing, and people would be very welcome and encouraged to be taking these medications while they live at this house. There would also be co-located services. So we mentioned the name Northern Lights Clubhouse, which some of you may know. That is also a peer support model for people who are struggling and just want some more access to a really great community support system. So Northern Lights Clubhouse would be a part of this and have services located there, as well as care facilitation, which again, some people might have heard of through the Pathways to Wellness program. And a care facilitator, their entire job is devoted to connecting somebody to the resources that they need to improve their life. So that care facilitator would work one-on-one with people to get access to therapy or help them get on insurance or whatever it is that's going on in their lives. They are incredible support systems for people. So again, really wrapping each of these people up in all of these different services. We would also be working to increase community partnerships. So we mentioned transportation is a real issue. And you know, what can happen when there's multiple people in a house at a time, and we have a partnership with the Ely Rides, for instance, and they all go to Virginia to get access to services. So just like, you know, building that collaborative network, as well as harm reduction awareness and stigma reduction efforts. So under Wellbeing Development, there's already a program called EPARC, Ely Prevention, Awareness, and Recovery Coalition, and they have been and continue to do work in this realm specifically around harm reduction, education, and prevention efforts as well. It's important to note a little bit about what recovery housing is in general. I know we've been using that word a lot, so I just want to place it for where it stands in this model. So as you can see in this picture here, this phase right here is called acute care. So you might think of that as a rehabilitation facility, somewhere that people go for, classic 28 days or so. And that's where they are achieving abstinence and sobriety for the first time, or maybe it's not their first time there, but that's where that initial kind of detox occurs. So this house would be a place for them to come after they have already achieved and maintained sobriety for 30 days in some sort of an inpatient treatment program. We are not going to be the very first stop on somebody's journey. We are going to be there when they move from an inpatient treatment center. So you can picture somebody going through that, already a very difficult process and journey. And they've been in a facility where they have a lot of support, a lot of structure, and a lot of care. And then they walk out those doors and they go right back into the situation that they were in, with all of the same triggers and stresses that brought them there in the first place. And while many people have support and families, they don't have the structure and support that they had in that inpatient treatment facility that allowed them to get the help that they needed. So this would be to address that gap of walking out the door and just going straight back to the same situation. We want to be able to provide people with the support and services that they need to rebuild their lives so that they can come back with the tools to better handle that situation. So this would be a residence that serves people from the Ely area. This is not like open to everybody across the country or the state. We really are an Ely-based nonprofit. This is an Ely-based effort. And that might, include Babbitt or the kind of Iron Range area, not necessarily, you don't have to have an Ely address per se, but this is for people who already live here and who just need help getting back into the community in a way that can support their health and wellness. So we also wanted to just address, these are some questions that seem to come up for people. We know you'll probably have many, many more, and we have, a long process to go before we have them all answered, but we wanted to give some space to answer a few proactively. So one that comes up is, how will the house be managed? We are planning to have a house manager who is also a peer recovery specialist. So somebody who is trained to help somebody on the journey of recovery and facing those challenges, as well as somebody who can have accountability for the day-to-day operations of the house. As I mentioned, the residents would all already be Ely or surrounding area community members. And there would also be an application and screening process. So we would want to make sure that these people are going to be a good fit for our services and vice versa. If people have a history of needing increased services, we want to make sure that they don't need more than we can offer. And we also want to make sure that it's going to be a safe place for everybody who lives there and for our community. So there would be a criminal background check. It's important to note too that many people who have substance use disorders do have some sort of interaction with the law at some point, given that some of these substances are illegal or over intoxication with these substances are illegal. So we would differentiate between a violent criminal background or a sexual criminal background and a criminal background that is an arrest for a drug use or something like that. And I don't have all the specifics of that exact protocol, but that's just an important distinction. In terms of how the house will be monitored, so NARR, you'll see there, the National Alliance for Recovery Residences has extensive protocol that they put out for people to follow. And so they have an amazing resource that really goes line by line and thinks through how to make a recovery residence effective and safe for its members and for the community. So we would be following that protocol. There's also a commitment to sobriety, and there would be drug testing and breathalyzing to make sure that people are maintaining that, and then to intervene if that's not happening, which again would be that peer recovery specialist would have the training to be the point person in those instances. In terms of the maintenance of the house, so well-being development would be the sort of owners and operators and functions basically as a landlord of sorts. And then in terms of the day-to-day upkeep, a big part of what the research that we found in recovery residences shows is that being a part of something, again, that peer network, and having pride in where they live is a really effective part of this process. So there would be expectations to do chores and participate in upkeep and work together to make this house a place that they can feel proud of. And then just a few other pieces. So we've talked a lot about treatment and interventions. There is a ton of evidence to show that recovery housing alone as an intervention is incredibly effective at improving outcomes. So you'll see on the screen here, this is like with the addition of recovery housing in comparison to going back into one's community or home situation without any support from a recovery housing model. So the comparison would be that with recovery housing, substance use decreases by half, reduces the probability of relapse again by over half, lowers incarceration rates by 2/3, and increases employment from 49% to 76%. There's also data to show that recovery housing saves $29,000 per person in costs and expenses compared to going back without recovery housing. And you can think of that as the cost of incarceration, the cost of lost income, or the health consequences that come about. So even just as an economic piece for the community as a whole, that also goes into, all those first responders. Those are community expenses of $29,000 per person that we would actually be saving and investing in the health and well-being of people. So we know that both for the individual, there's a ton of data that shows that it increases family functioning and wellness as well. And the community, we know that this is an evidence-based model that can really be an important piece in breaking that cycle of continuing to be addicted to substances. So now that we have talked quite a lot about our plans and program, I think it's important to note, well, another piece of what we're here to do today is a part of that stigma reduction and education. You all now are empowered with information, both about what we're up to and hopefully as we have these conversations about more of a lens of compassion for people who are struggling with addiction and substance use disorders. So it's an important piece of this that we start these conversations here with that lens of compassion so that we can create a community where people feel that they have support when they're struggling and that they can reach out for help. And another piece of what Kat mentioned earlier as well that we're hopeful that we can do here today, we do not come here as like people with all of the answers on high to tell you what we're doing. Throughout this entire process, it's been really important to get community support and to get people's insights. And you'll see that a lot of our data was directly from the conversations we're having with the community and the surveys. We want to know what you think, and we want to know what's going to be most effective for Ely, because this is a unique place, and this service is for our people. So we want to know from you what you think is most important about how we continue to move forward with this project. On the handouts, there's information about how to get in touch, upcoming forums. We have an email, info@elywbd.org, if you would like to continue to ask questions or have conversations. As Kat mentioned, we'll stick around afterward. But for right now, one way that we would like to foster that discussion is, again, I think everybody should have this sheet in front of them, and we can do groups of maybe 2 or 3, depending on who's next to you. We would love it if you all started moving through that sheet together and having conversations. And then towards the end of our hour here, we'll come back and share from the small groups of what were some key parts of your discussions and what are any questions, comments, or concerns that you want to make sure that we hear so that we can take those in as we continue forward. Yeah. Yeah, well, it'll be in town, and then, I don't know, do you wanna speak to the specifics? Great.
We've been wondering about this for a long time too, because Wellbeing Development does not have a deep savings account where we can just go buy a place. So we've been talking with folks in town. In fact, you guys might remember that about a year ago, we said, we need some help. We have to move out of the bowling alley. Well, we did move out of the bowling alley into June. Clubhouse is at St. Mary's Episcopal Church, which is awesome, but somewhat temporary because we're looking for a permanent place. The rest of us as admin folks are virtual. Lisa Liddell ended up with the graciousness of Grace Lutheran Church as an office space for her. So we've also been talking with a family here in town that has said that they'd be willing to have us hold up in their place. And it would be Peggy and John Jesme have said that they will let us use their house for a recovery place co-located with Clubhouse. That won't happen until next fall. So we've got, as Emmy alluded, we've got about a year to kind of plan and design and put our implementations spaces in order. So I know that's actually news for everybody. We've been careful about not passing it along because we wanted to make sure we had our ducks in a row. It's not 100% official because we haven't signed paperwork, but we've been in communication with the Jesmes and they've been are comfortable with me sharing that they have are in conversation with us about using their home. So you'll have to talk with the Jesmes. So that is exciting for us, and I wanted to share that with you. I think the address, I'm not going to remember the house number, but it's kitty corner downhill from St. Andrew's Catholic Church on Washington Avenue. Yep.
Yes. The manager.
Yes, actually, that's what we would be imagining. So what I'd like you to do, if you would, instead of asking questions as a large group, which is very fun to do, but what we would love, if you would be willing, is to do some small group conversations with these white sheets. There's some more in the back table. And it just prompts you to think through the conversation. Like, for example, the very first question is, what is something during our conversation today that caught your attention? Just share that kind of a conversation. If you write it down, we would love to collect these at the end and integrate this into our work. So we have time for design and implementation, problem solving and solution gathering over the next months. So what we would do, about 10 minutes of quiet time, and then I'll ask people if they're willing to report out some of the highlights of their conversation, and Emmy and I will walk around. So thank you very much. I'm gonna start wrapping up. So what I was thinking is maybe we could do some reporting on it. Is there any small group that would like to share a little bit about what they have been talking about? So I have a microphone. I'm going to just walk around. I've already got somebody volunteering. I have two microphones so that our remote people can hear too. So
I have two questions that kind of go together. Is where do the participants go after they finish at the house, and how long do they stay?
So great questions. And this is part of our design process. And so I don't have answers. But Emmy mentioned that the NAR, I don't know what it means, but it's an acronym for an organization that's knows a lot about recovery programs. And we would look to those protocols. Plus, I think I just don't even know exactly how to answer it. We've just got a bunch of design topics. Perfect.
So in our model, there's a number of different models that serve people for different lengths of time. Some places really say you're allowed to be here for 6 months and then you move on. And we found in our research that that model can neglect to actually take a person-centered approach, because where somebody is at in 6 months can be vastly different for different people. So rather than putting a very firm time limit on it, what we want to do is work with each individual and create goals for them and for their progress. And those goals would involve independent living at the end and building towards that. What do you need to get from here to there? Again, there's a lot of factors that go into that too. We all know that housing in Ely is very difficult as it stands for anyone. So some of that would depend, we're not gonna say it's been 6 months, go find somewhere to live and there's nowhere else to live, right? So by not having a super firm deadline, we're trying our best to take a person-centered approach, understand there's gonna be different situations for different people, and still build them up with the skills they need to get independent housing as quickly as is effective for them. That is also in progress. We're trying our best to figure out how we can make it the most affordable option for people. Pieces of it are that we will expect people to pay some sort of rent. By having multiple people in a house, we're hoping that that can reduce rent, and we're gonna do as much as we can to supplement with grant funding and whatever we can to help reduce the rent. We also hope that because of our program, including programs or services like connections to jobs and trainings and things like that, that we can help people to get income to be able to afford it. And we don't have a full answer of what that cost is gonna be or how much we can help supplement, but that's sort of one way that this model is also sustainable, is by asking people to contribute to rent in some capacity.
Are you planning to have a coalition of, or a partnership built with local, employers? And then social workers dealing with all kinds of aspects of that? Yeah. Because if you're expecting them to pay rent, they do have to have jobs.
Yeah, absolutely. And I think that is a big part of what we're hoping to do as we talked about with sort of forming those connections. And I think jobs are a big one, finding employers who are willing to partner with us and say, hey, we really want employees, here's trainings that we can help offer. And, how can we make this a mutually beneficial thing? As well as in terms of the connections with social workers and things like that. Care facilitation is a service that's very similar to that. They're technically community health workers, not social workers, but that service would be part of those co-located services, and making sure that we also, through that care facilitation, are connecting them with any resources that we can. So yes, social workers, if that's applicable, or any other such support services. And absolutely building those bridges and networks is going to be a really important part of this process, and making those community partnerships happen. Yeah. One more comment.
Our group was concerned or curious about what the interface with the police department would be, and how the police would be trained to deal with having this facility in the town, and how they would integrate their services together with the social services.
That's great. And I think I'm going to bring that mic back to Emmy just to respond to that, because she had a nice conversation with our police force. And I'd say that as an example, we're in communication with the St. Louis County Sheriff Department as well. And they're super supportive of our work, as is the local city police force as well, and the emergency responders.
Yeah, thank you for that question. That's a really good, another example of a really important relationship to be investing in. We mentioned the community stakeholder interviews. I actually interviewed a representative from the local police department, and he was very excited about this program because he has seen over his career firsthand that repetitive cycle of going to the same houses and the same people, bringing them, into an incarceration system for a day or two or however long, and then just seeing that continue over and over and over again. So and he said himself, he was like, it's hard for us. I know that putting this person in jail is not gonna be the best thing for them or for their families or for anyone. And it makes it harder for them to continue on their lives. There's nothing about this that's working, but this is the only option I have right now. And so, yeah, he was very supportive and I think, you know, spoke for the force as a whole as much as he could to say, we would love to have other options for people. We would love to be able to tell them what's available. And I think that's not to say that there might not be, you know, situations that involve police. We can't guarantee that for anybody ever. But we would hope that with increased communication and collaboration with the police department, we would be able to have a relationship where they know what we're up to and what's going on, and could talk to the peer recovery specialist if they see somebody who's struggling. And again, of course, if somebody is committing a crime, that's always going to be a police issue, and we're not going to step in to change that. If somebody, you know, needs to be arrested, that's going to happen regardless. We are not responsible for changing that outcome for somebody ever. Does that answer your question? Oh, I see. Yes. Yeah. Mhm. Mhm. Got it. Yeah, and I think that's a really important piece too, not just for the, you know, considering the people in this house, but people in general struggling with substance use or mental health issues. How can we promote some of these same educational resources for specifically the police officers? And I think we don't have like a. Sure, yeah. So we don't necessarily have a specific training on the books. We do, as WBD, we are sponsoring mental health first aid trainings, which is specifically in that realm of how to be able to understand that a mental health crisis or situation is happening and how to respond to it as such. So we're promoting those throughout the community, and we haven't signed up with the police, so I can't say that yet, but hopefully as promoting those trainings, we'd be able to increase that awareness, as well as what is a compassionate care team. For those of you who might have heard of it, that's a range mental health initiative that's designed, some of you might know of 988. There's other options other than 911 to call when somebody is going through a crisis, so that they can be met with trained mental health professionals first and foremost, rather than police officers. So that is an initiative too, that Range Mental Health has a mobile crisis response team. And that is an alternative option to help people in those situations in a different way. Yeah, they would help dispatch that team. Yeah, so that's a great phone number. The one thing with that I'll note is if you don't have an Ely phone number, it's not like 911 where it geolocates and knows where you are. It's going to call wherever your phone is from. So you might have to, it would be useful if you would like that number to look up. I don't have it with me, but the local crisis you can look up on rangementalhealth.com, and they have a phone number that would always go to them versus wherever you're located. Sure. Yeah, maybe they could connect you. Yeah.
So I'm gonna wrap us up because it's a little past 1 and I almost always try to end on time. So thank you, Lacey, and all of you for having us and for sticking around and having the conversation. Emmy and I'll be here for a few minutes if you have questions or comments you want to share. And truly, if you would write your thoughts down on those white pieces of paper and just leave them where you are or drop them up here anywhere, we'll take them and integrate them into our work. So thank you very much.
Thank you.